Thank you very much, Ruth. Thank you for the introduction. Welcome here, everybody, to the Faculty of Medicine presentation. My goal here today is to try and talk to you about some of the myths out there about applying to the program. There seems to be a lot of them floating out there, and I'm hoping today that I can kind of clear that up in your mind. My role at the University of Manitoba, I'm not a medical doctor myself. I do have a Bachelor of Science degree, as Ruth mentioned, from the University of Manitoba. My job is to make sure that the admissions committee rules and policies are followed in the admissions office when we select students to come into the program. I'm called the lead admissions officer in our program. So that is my role, and at the end of the presentation, I'm hoping to leave enough time so that you have time to ask me questions. So what I'll do is I'm going to go through my presentation probably a little bit quickly. My presentation is actually about 30 minutes long, but I'm going to try and go through some of the slides a little quickly so that I can leave some time at the end for you to ask me any questions should you have. And we also have a booth in the Manitoba Alley inside the Convention Center there as well, so if you want to come and ask us individually, you can do that as well. So why don't I just get started here. It's frozen. Hold on a sec. Okay, I just kind of wanted to start out with what a doctor is. In the media, we seem to have a notion of what a doctor is based on TV shows we've seen, and maybe that's not exactly the full picture. Okay, so firstly, obviously, a doctor is a healer and also a communicator. I mean, they're communicating with people on a regular basis all the time. A doctor is also a leader and a team player. So if you think about a doctor's job, they cannot treat a patient by themselves. They have to rely on the expertise of many other professionals, including nurses, specialists that are also MDs, but also people like occupational therapists, physical therapists, and those kinds of professions as well. Never ever will you work on your own. You have to be a team player. Lifelong learner. It's hard to get into the medicine program, and once you're in, you're going to be learning new things all of the time. And you're also an educator. So we have a lot of our graduates that finish the MD program, come back, and they also teach the medical students in the university. A scientist. So if you're also interested in doing research, when you have an MD degree, you can also consider going into research as well. A lot of our students are becoming more and more interested in and spending their summers doing research. For example, cancer research, if that's an interest of yours. And of course, you're a counselor for your patients and for other of your colleagues' patients as well. All right, so D is for doctor. What I wanted to do with this slide is kind of give you an idea of some of the residencies that are out there. So I don't have personal knowledge of residency because my job is to bring you into the program and get you through the undergraduate medical education program and graduate with an MD degree. When you finish with your MD degree, you're going to go into your residency. That's where you specialize, and that's when you're going to consider some of these here. Now, there's many, many more residencies you can consider as a medical doctor. These are just some of them, and there's many, many subspecialties. So, for example, if you see a third bullet down on the left-hand side is family medicine. There are a lot of subspecialties under that. One of the more popular ones is sports medicine. So sports medicine is a subspecialty of family medicine. So I want you to ask yourself some questions at this point. Do you care deeply about other people, their problems, and their pain? Do you mind repetition, and will you look below the surface for differences? Do you enjoy helping people with your skills and your knowledge? And do you enjoy learning and gaining new understanding? You may also want to ask yourself, do I understand the value of good learning just beyond making good grades? Do you often dig deeper into subject than your teachers require you to? Are you interested in how the human body functions? And finally, do you stay calm when others are acting squeamish? So in other words, can you handle blood? Can you handle looking at the joints within the human body? Those kinds of things. So if you answer yes to most of these questions, the chances are you have the right kind of personality for a medical career. So what can this career offer you? An opportunity to meet new people. You're going to meet new people every single day of your career. You get to do cool procedures and weird tests. So when I talk to our current medical students, they often are amazed at just the everyday things that they now can tie into the procedures that they're doing in school. So for example, a bunch of them went out to have chicken one night. And they're having chicken wings, and they had just learned about the elbow joint bone in class. So as they're ripping apart these chicken bones and eating them and having a good time, they realize that that joint bone in the chicken looks exactly like our elbow. So it's really strange to hear these kind of correlations that they make, but they do make them. So the MD career can also offer you the opportunity to help people when they really need you. And the freedom to live and work anywhere in the world, which is one of the perks of this job, I must say. The doctors that I work very closely with in my office are traveling all the time. They have been all over the world. Once you have an MD degree, you can go anywhere and you can work anywhere. So one of the doctors that I work with, he's just come back with a beautiful tan. He was in Jamaica for a month. Working in Jamaica. So, you know, he might go down and do some things for the local hospitals there or the local clinics, and he gets to enjoy the warm sun. We also have a doctor who regularly goes down to Haiti. He still goes down there. He's been going down there since the earthquake happened, and he's helping deal with some of the disease outbreaks out there. So at first he was going down there about every 2 weeks and then coming back for a week and then going back. But now he goes about once every month to go down and help the populations down there. So it just kind of gives you an idea as to what this kind of degree can offer you. Of course, the freedom to travel anywhere in the world, as I just mentioned. You have many career choices. So you're not just kind of pigeonholed into one area. You don't always have to work in a clinic. You don't always have to work in a hospital. You can also consider going into research if you would like. You can do education, so come back to the medical school and teach the students. Or you want to work in administration. Maybe you want to be the dean of medicine one day. Who knows? And you have lots of flexibility in your schedule. So as I mentioned, the doctor who went down to Jamaica recently. I mean, he's been a doctor for a long period of time, and so he does have that flexibility in his schedule where he can take off for a month. You know, as a new doctor, of course, you won't have that flexibility, but as you gain that experience, you'll have a little more flexibility in your schedule. And you have the ability to pay off your student debt. So going to medical school is not cheap, and you're going to incur some student debt, probably. The thing is, at the end of your MD degree, you have a guaranteed job waiting for you, so you'll be able to pay off that student debt quite quickly. So I often get asked, do I have to be brilliant? Only the brilliant kids get in, and that's not true. Firstly, I want to let you know that you need to really enjoy being around people. You need to enjoy continuous learning. You need to be a problem solver. Of course, medicine is all about problem solving. So if you really, really don't like that, then probably medicine is not for you. However, if you really enjoy that and you look forward to that, this may be the career for you. You need to like a lot of variety in your job. You need to be able to survive on sleep deprivation. Our medical students are allowed to be up for 36 hours before they have to take an 8-hour break. So that kind of gives you an idea of what is expected of you. So can you be awake for 36 hours and still function? You work weekends, you don't get a lot of vacation, you have to cancel vacations, and so you need to think about those things too. That's going to be a regular part of your job, and so if those things don't bother you, then maybe you want to go forward. But if you are a person who enjoys having your weekends off and doesn't like to be called in the middle of the night, then maybe this is not quite for you. And all the doctors that I know, they survive on caffeine alone, so you need to like caffeine, I think. But what I would recommend that you do is aspire to work hard. It's very competitive to get into the program. You need to be passionate about what you do, whether that's a volunteer experience or a work experience that you have. And if you want to get into medicine, be passionate about that. Learn as much as you can. You need to show that you can thrive under pressure and keep insanely busy. Our doctors are always insanely busy. They enjoy that pace of life, and if you enjoy that pace of life, then maybe this career is for you. And the most important thing I tell students in high school is to plan. It really is about the planning and how you strategically plan out your courses once you come into university. So what do the schools look for and how did they decide? So there's 17 medical schools across Canada. We are just one of those. Every medical school has different prerequisites in order to apply. So I'm going to speak specifically about what our prerequisites are, as I can't speak to what theirs are, but just keep in mind that if you are thinking about applying to other medical schools, they do have different prerequisites than we do. So you need to have a successful completion of an undergraduate course first at university. So it's not a direct entry program from high school. You need to get a degree first, whether that's a 3-year or 4-year degree, it doesn't matter. And it doesn't matter what sort of degree you get at this point in time. The admissions committee is not making any recommendations as to what they feel is a better degree. The most common degree, obviously, is a science degree. Most students who apply have a science degree, but we also have people with arts degrees, engineering degrees, nursing degrees. We've had paramedics apply, and so it really just spans the whole spectrum. The one core course that I'm going to look for when you apply is biochemistry. If I do not see that on your transcript, you're immediately cut from the competition. You have to have the second-year biochemistry course. There are prerequisites to taking a second-year course, of course. So you're going to need to take chemistry and biology, which are first-year courses, and organic chemistry, which is a second-year course as well. And we're also going to be looking for some humanities and social science courses. So those are courses like arts courses, for example. So any language courses, so for example, English, Spanish, French, any of that kind of thing, or psychology, sociology, gender studies, anything like that are considered humanities and social sciences. So what if you graduate from a high school in Manitoba and you want to go and do an undergraduate degree at a different university? That's okay, that's not a problem. We don't look at the university that you have attended, but the one caution that I do have is the biochemistry. So not everything entitled biochemistry at a different university is actually a biochemistry course. So like I said, if I don't see biochemistry on your transcript and it's not an approved equivalent course on your transcript, you'll be immediately cut from the competition. It's the first thing that I look for. So you need to ensure that your biochemistry you're taking, if you want to go to the University of Saskatchewan, for example, doesn't meet the University of Manitoba standards. So just keep that in mind. So what I would recommend that you take, so biochemistry is the required course, but the recommendations that I have for students is to also take courses in physics, microbiology, physiology, genetics, anatomy, and English or French literature. The reason that I recommend these courses is because you have to take the medical college admissions test, which is called the MCAT exam. That's one of our criteria in order to apply to our program, and you have to have a very, very high grade on this exam. All of these sections that I've listed here are on the exam. So there's a written portion, for example, that will cover English literature. You'll be given a passage and you'll have to write an essay on that. There are questions on physics. You do have to have a general knowledge of physics in order to apply. So every medical school has a grade point average that you have to apply. So right now, ours is 3.30, which is about a B. However, the students that get in have about a 4.2, which is an A. So we have 1,000 people who apply every year. We take 110, so there's a 1 in 10 chance of getting in. Of those 110, the majority of them have a 4.2 average. So just to give you an idea of the competitiveness of getting into the program. Now here's the medical college admissions test. This is I just mentioned, or the MCAT exam. This is what it looks like. It used to be a paper-based exam and is now done on a computer. There are about 20 stations, 25 stations at each computer, or at each sitting is what they call it. And it kind of looks like this picture here, where you sit at a computer, and the questions come up, and you answer each individual question. The exam is 5 hours long, and it costs about $250 to take it. And like I said, the exam is pretty important for your application to medicine. You have to do quite well. So it's a standardized exam that would allow me to compare students all across Canada. So we get students from all across Canada, right from British Columbia all the way to Newfoundland, who apply to our program. It allows me to look at your score from that exam and compare you to a student in Newfoundland, for example. So it's going to measure 4 key areas: the biological sciences, which include things like microphysiology, genetics, and organic chemistry. Section 2 is the physical sciences, which will do some testing on your chemistry knowledge. And there's a verbal reasoning section, so you're given a passage and then you have to comprehend the passage and answer questions on the passage. And 4th is the written station. So I've talked about grade point average and I've talked about MCAT exam. So that is measuring your cognitive aspects of your academic portion of your application. What I want to look for now is, now that we've done that assessment and we have a score for those 2 pieces of your application, I want to be able to measure your non-academic skills and abilities. So I'm looking for your integrity and your compassion, your respect, your empathy, your commitment, self-awareness, your leadership skills, your teamwork. What are your communication skills like? What are your problem-solving skills like? How do you deal with stress? And how do you resolve conflict? So I'm going to be looking for those kinds of things. So how do we do that? First, I want to mention before I get to it, and it's obviously I'm going towards the interview portion here. First, before I get there, I want to talk a little bit about your extracurricular and your work activities. So these are important for your application. You list them on your application, but they're not scored. They're not ranked in any way. One volunteer experience is not more important than another. I do want you to keep in mind that you should take some volunteer experiences or work experiences that reflect public or health-related service to the community. The reason for this is when you come to the interview, if you don't have any volunteer experience or work experience that is somewhat health-related, when you come to the interview, what are you going to talk to the panel members about? So they're going to give you a particular scenario, and you're going to have to answer questions on that. How are you going to support your ideas? How are you going to support, if you're asked to debate an issue, how are you going to support those things? So you might be able to draw on a volunteer experience you had and say, well, when I volunteered at the Victoria Hospital, this kind of situation happened. This is how we dealt with it, and I would deal with it actually in a different way. So it kind of provides you with some life experiences where you can go into that interview and say, I've actually thought about these kinds of scenarios. And you can also use these kind of experiences for your career exploration. So I'm going to give an example of a student who, she's now in her 3rd year. When she applied the first couple of times, she didn't get in. She knew that she wanted to be a pediatrician before she applied. She finally got in, and she came to me and she said, you know, I told you I wanted to be a pediatrician. That's where I kind of wanted to go. So I thought, well, I'm going to volunteer at a child care center, and I'm going to volunteer at the Children's Hospital, and I'm going to surround myself with children. I want to make sure that I'm doing the right thing. She hated every second of her volunteer experience, and she realized that she does not want to be a pediatrician. So those kinds of experiences can also lead you, not that that was a negative experience for her, but she knows now that when she goes forward in her medical career, she doesn't want to aim towards going to be a pediatrician. She's actually thinking about emergency medicine now. So that fast-paced is what she's looking for, and she just found the pace of the pediatrician was just a little too slow for her, and that she's looking for something a little faster. So you can use these kinds of experiences to figure out what you don't like and what you do like. All right, so I mentioned the interviews and the volunteer experiences, and those come into play in the interview. So this is actually what the interview looks like. It is called the multiple mini interview. We no longer do the panel interview where there's a panel up front and it only holds you there, and you have to answer questions for an hour. This is what it looks like, and as you can see, the students are lined up in a line down the hallway, and above their heads you can see a yellow piece of paper. That is the scenario that they have to read. They're going to hear a buzzer. They're going to stand up and read that scenario. They have 2 minutes, and they're going to hear another buzzer. The buzzer is going to indicate that they need to enter the room and talk to the interviewer about that particular scenario. They enter the room, they go inside. There is one single person in the room, and they're going to discuss that scenario with that interviewer for a period of 8 minutes. The buzzer will sound, the student will exit, and the interviewer has 2 minutes to score. You move to the next station and you do exactly the same thing. You are there for 2 hours. The exam is 2 hours. You go through 12 stations. And the interviewers are very kind-hearted, wonderful clinicians and med students who want you to do well. So don't be frightened of this experience. Just know that you need to have your head on straight and make sure that you know who you are before you get to this experience here. So, like I said, there's 12 stations, 8 minutes each, and this is the final piece that we use to analyze your application to the Faculty of Medicine. So is getting into medical school as tough as they say? It certainly is. As I mentioned before, 1,000 people apply every year. We only take 110. Our quota is set by the government of Manitoba. We can only take 110. And so you really have to make sure your grades are really high, you do really well in your MCAT to get invited to that interview so that you can show the interviewers who you are and why you want to be in this program. So medical schools are really looking for the finest minds and the most motivated students who have demonstrated interest in working with people. Just keep that in mind. All 17 schools have the same goal. So what do I have to do now? Now that I've terrified you and scared you and now you think you're never going to get in, what do you have to know now that you're in high school? Firstly, just relax. This is the perfect time to start planning. If this is what you want, you know that in the future you want to be a medical doctor and this is all you've ever thought about, then now is the time to start planning. Just relax. You have time on your side. Use your guidance counselors, and when you come into university, certainly go see a student advisor. They can help set up your calendar for you so that you are not overwhelmed and that you get the highest grades possible. Also try volunteering in a healthcare setting. Hospitals, personal care homes, or clinics are good places to start, and they're always looking for volunteers. And you can try job shadowing a physician. Now, all you have to do is find somebody who works in the healthcare field, whether that's a nurse, an occupational therapist, and ask them if they know of any doctors who allow job shadowing. And you're going to want to do job shadowing for a period of time. So if you find a family physician, for example, who will allow you to job shadow for a couple of months, take that opportunity. Follow that doctor around, see what that doctor deals with on a daily basis and on a monthly basis, and ask lots of questions. And talk to our medical students. They always love to talk about themselves. So if you ever come across a medical student, take the opportunity to sit down with them and say, you know, what was your application experience like? What is medical school like? Tell them about yourselves and try and figure out, is this the right career for you? What do you need to do in order to be successful in getting into this program? Learn from their experiences. Like I said, they're always very chatty and they love to talk about themselves. And normally I bring some med school students with me, but they had mandatory classes today and unfortunately they couldn't be here. But at the end of this presentation, I hope to share just a couple of their comments with you just so that you can see that this is not an impossible task. So I'm going to go through this part really quickly. Firstly, you need to finish high school. You're all aware of that. Next, you're going to need to go to university. Be brave and follow your instincts and don't follow your friends. Thirdly, keep your options open. So be open to opportunities that are presented to you. So for example, if you have an interest in a specific science problem and you want to become a researcher and a door has opened for you, grab that opportunity. You can still come into the medicine program later. Or maybe that's your plan B. If you don't get into the medicine program, what's your plan B going to be? Talk to your friends and your peers. Lots of med and pre-med students who can give you advice and share your challenges. So as I mentioned before, med students are great. Pre-med students, if you can find some once you come to university, usually are a good support. And don't panic if you hear rumors about changes that sound unfamiliar with the admissions office. Our admissions committee's job is to make sure that the selection process is fair and accurate, and sometimes they have to change rules in order to make sure that it's fair for all students who apply. I put this picture here of one of our graduating classes, and I wanted you to kind of get a sense of that day that they graduated and how cohesive of a group they were. Everybody in the class knows everybody. They are all best of friends. They consider each other brothers and sisters. So it's a wonderful, wonderful program. And as you can see, they become one great big huge family. So I often get asked, what is medical school like? And the med students tell me it's a lot like high school. There's only 110 kids in your class. You get to know everybody in that class. And everybody becomes best of friends. So med school is 4 years in total. First years are in the classroom, small group learning, some lectures like this, but not very many. Mostly it's small group learning. Those first 2 years are called pre-clerkship, and the final years are your clinical or clerkship years, where you're actually in the hospitals and in rotation. All right, so before I take some questions from you, I just wanted to put this picture up here. It's a gentleman turning the page, and I just want you to ask yourself, when you turn that page, what is the next step for you? Just to think about that a little bit. And I just wanted to provide you with some of the med school perspective. They were sorry they couldn't be here today, but some of the students just kind of wanted to give you a little bit of a message. So I'm going to read directly from their emails. I knew at a very young age that I was adopted, and I grew up in a farming community in Steinbach, and I embraced the rural lifestyle, but I was always curious about my roots. My adoptive mother had high hopes for me and pushed me to do my best. She hoped I would have a glamorous job someday, like a secretary or something. I found out that my birth mother was of Aboriginal ancestry and began to search out ways to include this culture in my life. For years now, I have volunteered at a camp mentoring Aboriginal youth. The proudest moment of my family's life is watching me receive my white coat in August 2010. In 2 years, I will graduate, and if this is what you want, go for it. I did it, and I'm happy that I did so. So that's just one message from one of our med students, that she's so happy that she took that leap and she applied. She got in on her first try. So it just shows you that it can be done.